Hi, this is Paul Barr with Hospitals and Health Networks magazine. Today I'm here with Cara James, Director of the Office for Minority Health at CMS. We're here to talk about some changes that are taking place in our office and at CMS. Thanks for being here.
Thank you for having me.
I understand you've expanded your existing From Coverage to Care program recently. Could you talk a little bit about that?
Sure. From Coverage to Care is an initiative that we started in June of 2014 to help those individuals with coverage understand their coverage and connect to the care that they need. And this week, we're here in Chicago to announce the release of some new resources to help consumers maximize their coverage. So 5 ways to make the most of their coverage. And we like to talk about this as what are the 5 things that everyone should know how to do now that they have coverage.
Recently, you also released some tools that are geared towards providers in terms of reducing disparities.
Yes, so those tools are separate from Coverage to Care. And our office recently released the Mapping Medicare Disparities tool. This is a map that allows providers, local health departments, other individuals to go in and compare prevalence rates for diseases, costs, morbidity for diseases, as well as readmissions, to look at 18 different conditions and to be able to compare at a county level by race and ethnicity. They can also look at them by gender, or for those individuals who may be dually eligible for Medicare and Medicaid. So that tool was recently released in March. We also have another tool that allows providers to focus on how they can reduce disparities in readmissions. We know a lot of providers are focusing on this area, and we do see that there are disparities in readmissions. So this guide provides steps that they can take to identify where they have a problem, to develop a plan, and to implement that to reduce the disparities that they see.
These tools are only going to be as good as the data that goes into it. What are you doing to try to improve the quality of the data that's being collected?
Absolutely. Data is central to our ability to both understand where we have problems and to measure our progress in implementing change. And it's the reason that improving our data collection and analysis and reporting is the number one priority of our CMS equity plan for improving quality in Medicare. So we have incorporated the expanded data categories for race and ethnicity into our surveys, as well as the Marketplace application and the Medicaid application. We have also added these questions to our surveys and other places. And we're cognitively testing questions around language preference, as well as questions around sexual identity for individuals to see how we can ask those questions to begin to understand what's happening for that population as well.
Finally, what else is happening at CMS in terms of trying to reduce disparities?
There's a lot going on at CMS right now to reduce disparities, but the tools that we've talked about, the initiatives such as From Coverage to Care, those are all great, but we're also working to embed a focus on health equity into our programs. So as we look at new programs such as our MIPS, the Merit Incentive Payment System that's coming, how do we think about embedding a focus on equity as that's rolling out the door? We worked with our Center for Medicare and Medicaid Innovation on the recently announced Accountable Health Communities model to incorporate disparities impact statements into those, where we're asking applicants to look at the population they plan to serve and how that differs and the challenges that they face from the larger geographic population, to put a plan in place to monitor disparities as the program is being implemented, and to do quality improvement if they see disparities expanding or worsening while the model is being implemented. So we're very excited about these opportunities to really embed a focus on health equity into our agency's work.
Thanks for sharing all that with us today.
Thank you for having me.
For Hospitals and Health Networks, this is Paul Barr.